Hello, welcome to my YouTube channel. My name is Tita Aki and today we are going to discuss about endocarditis. Endocarditis is infection of endocardium which occurs when organisms travel through bloodstream to the heart valves or other parts of endocardium. Let's talk about causes of endocarditis. It can be caused by bacteria such as strep or staphylococcus. Also, it can be caused by fungi such as candida. Now let's talk about susceptible factors. IV drug use, valve replacement, repair, debilitation, dental surgery, long-term IV antibiotic therapy, indwelling catheter placement. Usually when a patient has a history of endocarditis, they give a prophylactic antibiotics before doing any procedure to prevent bacteria. Now let's talk about signs and symptoms of endocarditis. Fever with chills and diaphoresis, fatigue, weakness, weight loss, anorexia, cough, arthralgia, splenomegaly, fatigue, heart failure, heart murmur, embolic complications, clapping of the fingers, splinter hemorrhages in the nail beds, fatigue on the trunk, conjunctiva, and mucosa, road spots, ocular nodes, and chainway lesion on the skin. Now let's discuss about laboratory and diagnostic study finding of endocarditis. WBC will be elevated. Also elevated erythrocyte sedimentation rate, ESR, anemia. ECG or EKG will show arrhythmia and cardiomegaly. Echo will show valvular damage, and then positive blood cultures. Now let's talk about nursing intervention for endocarditis. What a nurse can do: administer medication as ordered, monitor temperature, monitor signs of CHF, cerebrovascular complication, and valve stenosis. Prepare the patient for valve replacement, provide adequate rest, assess for clapping fingers, monitor for pulmonary emboli. And signs and symptoms for pulmonary emboli is pleuritic chest pain, dyspnea, and cough. Monitor renal emboli, and signs of renal emboli is flank pain, hematuria, which is blood in the urine, and pyuria, which is pus in the urine. Monitor for splenic emboli, which is sudden abdominal pain radiating left shoulder, rebound abdominal tenderness on palpation. Now let's talk about patient or family teachings. Record temperature daily and report fever to the provider. Need prophylactic antibiotics before dental work, childbirth, genitourinary, gastrointestinal, or gynecology procedures. Observe signs and symptoms of embolic and heart failure. Avoid oral irrigation devices and flossing to avoid bacteria. Monitor IV site for signs of infection. Administer IV antibiotics as scheduled. Use aseptic technique during setup and administer IV antibiotics. Perform oral hygiene at least 2 times a day with soft toothbrush. Inform provide of history of endocarditis before performing any procedure. Clean skin laceration thoroughly and apply antibiotics as ordered. Let's now talk about medication for endocarditis. Depending with the cause, if it's bacterial or fungi, some of the antibiotics that can be used for bacterial is penicillin, nafcillin or oxacillin, gentamicin, vancomycin, solid or deptomycin. And then some of antifungals for fungi are caspofungin, micafungin, adenolafungin, risafungin. Now let's talk about complication of endocarditis: heart valve damage, blood clots, abscess in the brain, heart and lungs, meningitis, spleen enlargement, stroke and heart failure, kidney damage. Thank you for watching my YouTube channel. Please share and subscribe.